Good afternoon. My name is Tony Miller, and I'm re-recording our presentation that we did last week on the HRSA grant opportunity for the Primary Care Training and Enhancement Awards, which is HRSA 16042. Thank you for joining me today, and because this is a recorded presentation, we will not take any questions. We're assuming that everyone had the opportunity to at least review the FOA or the funding opportunity announcement or the program guidance that is available at grants.gov. You can use the HRSA 16042 as a way to access that. I would really suggest that you get that announcement and review it very carefully before you start your grant. I've already told you who I am, so we'll move on to the next slide. The purpose of this announcement is the program is to strengthen the primary care workforce, and it has a focus on enhancing training for future primary care clinicians, teachers, and researchers. Important to note is the deadline for receipt of the grant application is December 16th, 2015 at 11:59 p.m. A little bit of nuts and bolts on this particular announcement. There are $14.9 million, or almost $15 million, anticipated to be dispersed with this grant cycle. The PA application is $1.8 million, which is roughly translate to about 12% of all the funding. HRSA expects to award 37 awards beginning July 1st, 2016. If you did some calculations on that, if they were awarded $250,000, if all came in at that level, they would be able to give about 60 grants. If all of them came up under the collaboration at $500,000 maximum, they would be able to award about 30 grants. So they're anticipating some of the grants will come in as collaboration, and some of them will come in as individual grants or single project grants. The awards are for 5 years. You would get continuing funding for your grant if it's approved and funded. If Congress appropriates the funding for subsequent years, and if you show or demonstrate progress on the grant per filing of your progress and performance reports. As I mentioned earlier, the limits are $250,000 per year for a single project and $500,000 per year for a collaborative project. Those amounts include the modified indirect at 8%. And if you need to know what modified indirect means, you can look in the guidance and find out exactly what that means. There are some restrictions on the 8%. On some of the funding that you might get. Multiple applications from organizations are not allowed, and an organization is defined by a unique federal ID number. Awardees from last year are not eligible to come in as a primary funder or applicant. However, they may participate in the as a collaborating organization on another grant. Who is available to get funding are accredited public and nonprofit PA programs, including provisionally accredited programs. And I received an email back from the project officer indicating that provisionally accredited programs, while eligible, would need to achieve full accreditation at a certain time frame. And I would suggest to get clarification on that time frame from HRSA. The lead applicant must be from family medicine, general peds, general internal medicine, a medical school, physician assistant program, or faculty from one of the preceding. Collaboration must propose training across the continuum and across primary care disciplines. What that means is across the continuum would be, for example, medical students and residents. So across the continuum of training, and across disciplines would be family medicine with pediatrics. That would be two different disciplines, or family medicine and physician assistant. Collaborative projects must include at least two of the following professions: primary care physicians, PAs, NPs, dentists, mental health providers, pharmacists, and other allied health professions, which we assume would include physical therapy, occupational therapy, and such. Important note, applicants for the FY Primary Care Training Enhancement opportunity must focus on training that transforms healthcare systems, and in particular, enhancing clinical training experiences of trainees. There's a lot of focus on clinical education in this particular funding announcement. Excuse me. Applicants must describe how your proposed activities will increase diversity in the healthcare workforce, and you must propose an evaluation plan which focuses on assessment of outcomes related to graduate career choices, patient access, quality of care, and cost effectiveness in the clinical training environment. So again, you must focus on training. You must have good outcomes through an evaluation plan, and you have to show how you're going to increase diversity in the health workforce. A side note on the evaluation plan, HRSA does plan on providing expert consultation to awardees to help them further develop their evaluation plan, but it must stand on its own in the process of the application evaluation. Here are some examples of outcomes that you could choose from. You don't have to pick all of them. You could pick some of these, but you have to have demonstrated outcomes that are part of your grant application and show, for example, that your graduates or are providing patient service, that your quality of care has been enhanced by your graduates. Things that are listed on here are important. So some of these are difficult to, as we know, to demonstrate within a training grant because a lot of the indicators are about graduates. But I think that this really stresses the importance that your grant has to look forward to evaluation beyond the training itself. This particular slide, I'm not going to go through every single one of these on here, but I wanted to point out that the grant can be used to provide training for physician assistant students. It could also be used to provide faculty development. If you'll notice in number 5 where it says training physicians or physician assistants teaching in community-based settings. You could potentially use this for preceptor development as well. Number 7, I think, is worth noting. It does allow for financial assistance in the form of traineeships and fellowships, and PAs are included in this. I think what it might allow you to do is to provide a traineeship or a fellowship for faculty development purposes. Some schools have already done similar kinds of activities in their grants. Or you could potentially use this fund like one of the former grants that were available a few years ago, the EPAT funding, which is expanding physician assistant training grants that were available about 5 years ago, that came along with the ACA enactment. There is a table within the program guidance that tells you that how much that you are able to provide through these traineeships or fellowships. The funding authority wants you to transform healthcare systems as part of your initiative. This gives you some examples that they brought in from CMS to demonstrate some potential ways to show that your grant activities have transformed healthcare systems. Again, it's focusing on having those clinical partners. It would be my interpretation of this particular grant, and that you would need to have that as part of your application. I think one of the things that, just as one thought, would be under the bullet that says providers leverage the use of health information technology to improve quality. Potentially, I could see that you might use your students to do an EHR audit as part of their training that would be focused on quality, but at the same time could enhance their learning because they're looking for gap analysis and quality indicators. So I could see that as one way of meeting this particular transformation experience, at the same time providing an education experience as well. The final thing on this particular page is that HRSA does encourage projects that address social determinants of health while addressing healthcare transformation. One potential way of that is to increase your modules in one of your public health courses or modules on this particular topic, social determinants of health or care of vulnerable populations. Your whether or not you get funded is based on a number of things, and primarily the score that you get on your grant. And we'll be talking about the review criteria in a little bit, but also what we call bonus points or preferences. And right now, there are two ways to get preferences. One is to demonstrate that you either have a high rate of placing graduates, program completers in medically underserved communities, or demonstrate an increase in the rate of placing graduates in MUCs. So one is high rate or significant increase. If you're a new program, you can apply as a new program for funding preference. And according to HRSA, a new program is one that's defined as only been in operation for about 3 years, that you haven't had more than 3 classes come through. The percentages or the benchmarks that you need for high rate and for significant increase are also contained in the funding announcement as well. The bar for PA programs for a high rate is 30% in MUCs, and a significant increase is, I believe, 25% for physician assistant programs. The new programs don't automatically get the preference. You have to show that you meet some of the 4 criteria that they have in the announcement on page 27 to show that you are eligible as a new program, because you've met the 4 criteria, at least 4 criteria as defined in the program announcement. Important point is that you have to ask specifically for funding preference, and you have to show why you feel like you meet that particular funding preference. So it has to be specifically outlined in your grant. This particular slide shows what you can use the funds for, and there's a number of things, including just particularly training of students. But that's important for PA students, working with other disciplines in team-based practice models. I think that's a very important aspect of this funding authority. Training PAs and physicians together in community health settings. So using community health centers would probably be a good way to proceed with a grant application. You can also use this particular funding to develop joint graduate degree programs in public health. So a PA/MPH program would be particularly interesting to them. I've already discussed the need-based financial assistance through traineeships or fellowships. And you can use those for teachers or researchers to take faculty or clinicians and get them the researcher training or the teaching training, as well as we believe that PA students are eligible for this financial aid or financial assistance as well. It might be a way that you can use your funding to increase the diversity within your program. Key considerations that you should think about as you write your grant and develop the activities that you're going to do as part of the grant is to include something along the lines of transformation of healthcare delivery systems. Again, noting the criteria that they've outlined in the grant and which I covered on a previous slide. Working on collaborative projects across the training, which would include physicians and PAs and so forth. There is a veterans focus, and there's not a lot of guidance on how to proceed with the veterans focus, but it certainly is encouraged particularly for PA programs. Evaluation plan is very, very important in your project proposal. You need to show graduate outcomes, patient access, improvement, quality of care, and cost effectiveness in clinical training environment. Not necessarily all those, but you do need to show an evaluation, particularly graduate outcomes is very, very important. In order to get started, if you've never written a grant before or your institution has not applied for funding, you must complete these items that are listed on this slide. You need to get a Dun & Bradstreet number or DUNS number. You have to register in the SAM system, and you have to register in grants.gov and specify who your authorized organizational representative and who's going to have permission to enter information for your proposal into the system. These are really, really important that you get started on that because once you register, you don't get the numbers right away. You may have to wait a little while. So this is something that should be done ASAP. As you write your grant, you have to keep in mind, just like you do for your students, that you want to have papers that are done according to the format that you've specified. And HRSA specifies 70 pages is the limit. That includes a number of things, including your attachments, but there are some standard forms that you have to fill out that are not included in the page limit. And I believe that the system does an automatic audit as you enter the materials to see what you have, and it also will tell you which ones count, which ones do not. But do make sure that you pay attention to this. We really recommend that you write your grant application in Microsoft Word so you can upload it into that system. You can page check yourself that way with your attachments and also with your Word. Make a spreadsheet that shows how many pages in each section so you can continue to add those. As you add attachments, it'll automatically update how many pages you're at. We also recommend that you do a spreadsheet in Excel or a similar kind of product that allows you to do your calculations for your budget to make sure that what you will eventually put into the system will add up properly and that all the numbers come out the way you think that they should. The budget is uploaded into a HRSA document. That's a form that you fill out. It's not uploading an Excel spreadsheet. But we recommend that you start with the spreadsheet so you can monitor that on your own. When you start writing the grant, make sure that you use the program guidance. it's a lot of detail there, and that you should read it and read it again and read it again. And anybody that's involved in preparing the grant application should begin by looking at that. Create an outline from the program guidance, which basically goes over the sections that you will need to include. Brainstorm with all of your faculty and your partners about what you want to accomplish. Make sure that you get buy-in from everybody, and but nonetheless, one person should coordinate the grant so that one particular person is in charge of it, making sure that all the I's are dotted and the T's are crossed. As you get individuals lined up, you'll create an action plan that are based on your goals and objectives, and you want to make sure that you attach timelines and areas of responsibility for those. The major sections of the grant that you need to pay attention to and have clearly defined both within the table of contents so that your reviewers can find things, and make sure that you use section headings so that, again, as people are reading it, they can quickly find what they're looking for. So the first thing is a project abstract that actually is submitted as an attachment to the grant. So it's one of those things that you would write last after you get everything else done. There are 4 to 5 required elements that are needed in an abstract. Make sure you look at that in the guidance and that you have all those items included. The next section is the project narrative. The key areas are the purpose and need. Purpose and need should describe why you need to do what you want to do within your project, and this section really needs to be referenced with the citations from the literature that demonstrate why there's a particular problem that you need to solve. So liberal use of references in this particular section. I would recommend a couple sites for you. One of them is the Kaiser Family Foundation. The other one is Commonwealth Fund. And I guess the third one would be your state health department, that will show indicators of how your particular state or region is doing with health requirements and outcomes on diseases and disability. The next section is the work plan. The next section is response to program purpose, which includes methodology and approach, your work plan, and there's a HRSA template. I'll show you an example of that in a little bit, but you need to use that particular template or a similar template. Resolution of challenges, so you can't just say we're really a great institution and we don't anticipate any problems with implementing this grant. You really have to have a realistic discussion of what are the potential obstacles and how you're going to get around those. The next section is impact, which is evaluation, technical support capacity, and sustainability. Basically, how much will your project have an impact within the community and within your institution, and whether or not you can continue to do that over time when the grant funds run out. Finally, you have organizational information, which includes your bio sketches, what kind of resources you're going to use, and what are your capabilities. They want to have some level of comfort that somebody in your institution, particularly your project director, has the expertise to be able to carry this out. And part of the evidence would be that they've had similar kind of projects that they've done successfully, or if not a HRSA grant, any other type of grant, even an institutional grant. The budget I talked about a little bit already. Budget has to be realistic. It has to be within the limits that HRSA has set, and it has to be linked to what you plan on doing in terms of your methods and approach and your work plan. And there is a narrative section, which is basically describing how you're going to use the funds, how you developed the amounts that you came up with. So, for example, if you're including cost of living increases for the the personnel on your grant, how is that determined? What did you use some type of cost of living indicator for the past 3 years and expecting that it's going to be the same? They'll want to look at fringe benefits. What is your fringe rate for your institution? And making sure that that is documented. If you're asking for travel, how did you determine that travel? How many miles? What was the rate that you were using, preferably the federal rate for reimbursement of travel miles in one's own car? Or if you're using, if it involves air travel, did you do some research and come up with a realistic number for that? There's a number of attachments. Some are required and some are optional. And again, those are detailed in the program guide. Here's an example of the work plan. So you could see that it starts off with you putting the goal. What are the outcomes? What are the objectives? What needs to be accomplished in terms of key tasks? Who's going to do it? When's it going to start? When's it going to end? So you want to have these listed by month and year. And also make sure that it follows the grant cycle. So your start would be July 1 of 2016. And so for the first year of funding, it would end on June 30th of the following year, and then each subsequent year using a July to June timetable. HRSA is now also requiring that you include a logic model to describe your project graphically, and here's the example from the source that they give, and so you would basically replicate this according to the project that you are going to propose. There are other ways of doing logic models as well, and I think I've given you one more example here. It's fundamentally about the same, but just a little bit different format. So you can basically choose your format. I don't think that they're locking you into one particular model. And later on in the resource section, I will show you a link for the Kellogg Foundation, which has a really good explanation of logic models so that you can understand those a little bit clearer. Your grant, once it's received by HRSA, at some point it will go to a peer review panel, which is made up of PA faculty, PA clinicians, physicians, nurses, public sector folks, and so forth. And what they'll do is read your grant, and they'll come on a conference call and basically decide on how they're scored and which ones are approved, which are not approved, which are and how many points you get. So it's a really good idea for you to review the criteria and how many points that they're worth within the program guide, and this gives you just an outline of how many points that each section is worth. So you can see that you really want to focus on the response to program purpose, as well as the impact sections, those being 2 and 3. Those carry the most weight, 35 points and 25 points respectively. So it's really important that that you focus on those. Not to say that any of the other areas should be short shrifted, but it's important that you focus on those core. Remember, as you're writing the grant, that you keep in mind the purpose of the grant support, as we reviewed, and which is also included in the program guide, that you put your program needs within the HRSA framework. So in other words, you may come with an idea that you would like to get funding for X, Y, and Z, but your job is really to take your needs and match them up with the federal government's needs. And when you can do that successfully, you're more likely to get funded. Make sure that you proofread your grant many, many times. Have other people review it, not just yourself, because often if you are the main author, you're not going to pick up on errors as you reread your own work. Get somebody else to read it as well. Make sure that you look at that program guide before you start writing, while you're writing, and when you finish writing. Um, use the program guide and the review criteria as sort of an audit of your proposal. And that's what I mean by do your own review. When you're writing this up, writing your project, keep in mind that progress and performance reports will be required. One of the things that you could potentially ask for is a staff member to help you with collecting data and reporting data. If that's somebody you don't have in your institution already or within your program already, that's something you potentially could ask for to help support the requirements that you're going to need to track graduates as well as your students. Why are grants not approved? Well, the peer review panels are secretive to some extent, although I could tell you that you can request um, other people's grants through the Freedom of Information Act. It's a little bit too late to do that for this year, but for subsequent years, certainly you can go to the FOIA request site and file for applications that were approved with high scores. But as far as grants not being approved, one is that they just are not written well, and the reviewers have a hard time figuring out what you're trying to say. That you did not follow directions, and if you don't follow directions, let's say you get 75 pages, HRSA may say we're just not going to send it on to the reviewers. They potentially could kick it back to you and say knock out 5 pages, but they don't have to do that. They can just say sorry, you went overboard on your pages and we're not forwarding it on to the reviewers, which means that you'll never get a chance to get it scored. Incomplete or missing sections, if you forget to write a budget narrative, there's a lot of points right there that you would not get scored on, and they would not be able to determine whether or not your budget is reasonable. So make sure that no sections are missing. Make sure that your budget supports your grant objectives. Don't just try to ask for money for things that are not related to what you want to accomplish with the grant goals and objectives. Make sure that your budget justification well documents how you're going to spend the money or why you need the money. Again, I gave you some examples already in terms of documenting the cost of travel. How many visits are you going to make? What's the average distance? Who's going to be doing that travel and so forth. Make sure that you're matching what HRSA wants and what you want. I've already talked about that. And certainly in the past, they've actually given points for innovation. It's not in the current review criteria. But I think reviewers are looking for something that's a little bit innovative because part of what you're going to do is to disseminate what you have accomplished in your grants to other programs and institutions. However, you don't want to get too crazy because then they'll question whether or not you can pull it off. Some grants get approved, but then they're not funded. In other words, their score isn't high enough to meet the bar in order to get funded. Why do they get to that? Well, one, it could be a very well done grant, but we anticipate a lot of competition. And if there's 100 and some institutions applying for the grants and only 37 awards are expected, then you know that some people are not going to get funded. So the competition is high. If you're not eligible for a funding preference, and you're not going to get that funding preference bump, and that indeed helps many schools. And then finally, something that for me is new, and that is a clause in the guidance that says HRSA anticipates funding at least one awardee in each of the 10 Health and Human Services regions. And that means that you could potentially have a high score, but there's another score that's about as high as you, or maybe a couple points less, but you already have somebody got an award in your region because they had a little bit higher score than you did. Then it'll go, instead of going to you, it'll probably go to the next region, even though their score is a little bit lower. So keep that in mind. Key points that I want to make before I get close to the end is, one, make sure that you have collaboration both internally and externally internally across some of the departments, well, within your school, maybe PA in family medicine or PA in dentistry, but also externally. Look for opportunities with community health centers, on other agencies, agencies on aging, for example, if you want to do something along the lines with geriatrics. Maybe pipeline programs to help increase your diversity within your program. So look at those. You could even name PAEA if you check with us in advance for some type of external collaboration in some of the areas that we have resources. Make sure that the people that you have listed in the grant know that they're being listed and they are willing to move ahead with those projects as part of their workload. So you need to have faculty buy-in. If you get a chance, read other grant applications that have been successful to give you some hints. You can volunteer to be a peer review panelist for the grant reviews. That's one of the ways that I learned the most, is being a panelist. You get to see lots of grants. You get to see how they're scored, and it's a very, very helpful thing. There is a website that HRSA has. If you Google it, I'm sure you'll be able to find how to volunteer and sign up to be a grant reviewer. Again, I can't overemphasize the need to proofread, check your math, use a spreadsheet like Excel to do the math for you, assuming you have the right calculations plugged in. And make sure that you show sustainability in the narrative and the budget. In other words, you need a document that you will be able to continue doing this project once grant funds run out. Make sure that you use the tables that HRSA wants you to include, and there's a couple of them, so those have to be included. Make sure that you're aware that you need to track data for future reporting. I've talked about that already. And although it's late for a Freedom of Information Act request, if you know one of your program directors across the country or within your region that has been successful, you may want to check with them to see if they're willing to share their grant, just to see the formatting and so forth, obviously, not to necessarily steal their ideas. A couple of resources are listed on this page, including the logic model from Kellogg Foundation that I mentioned earlier. If you have any other questions, we can be a resource for you at PAEA, and I have my email listed there, tmiller@paeaonline.org. But it's always best to direct your technical questions to the HRSA project officer. I always recommend that you do it by email so that you document what they're telling you in terms of a written response, because sometimes if you misunderstand something on an oral conversation, there's a potential that that could be a negative consequence for you, and then you don't have as much defense if you don't have it in writing. Some other helpful hints. If you were on the original program that we did, or webinar that we did last week, you still had time to register for the workshop, but our deadline was last Sunday, so that has expired. And don't forget that there's a technical assistance grant call on November 5th from 3 to 4:30 Eastern Time. And this information I have here about the technical assistance call is also contained in the program guide. That is the end of our presentation for today, and thank you. We look forward to seeing lots of successful grants from our member programs, and good luck to all of you.